Good morning. My name is Jennifer Harmoning, President of the Burnsville Chamber of Commerce. I'm here in partnership today with our City Manager, Melanie Lee from the City of Burnsville, hosting our October Small Business Sounding Board. I will turn the program over to City Manager Lee to introduce our speakers this morning.
Thanks, Jennifer. Good morning, everybody. My name is Melanie Lee. I'm the City Manager for Burnsville. I'm glad to see that you're able to join us today. We are fortunate to have our police chief here with us this morning to share some insights on what they are working on, some of the challenges that the department is working through, and some of the great work that they're doing. So with that, I would like to turn it over to Chief Schwartz.
Thank you, Melanie. Thank you, Jennifer. I really appreciate you guys inviting me here. So I've got a lot of ground to cover, but just for those of you that don't know me, again, my name is Tanya Schwartz, and I've been with the City of Burnsville for 25 years. So I've been here a long time, been the chief for about a year and a half, and I'm very invested in the city and the community. And so just really appreciate this opportunity. So I'm going to talk a little bit about COVID-19, our response, a little bit about civil unrest and what's been going on across the country, how that has been impacting us here, and then a little bit about police accountability legislation. So a lot of ground, and again, I'll be able to stick around for questions, so we'll get through all of that. But first of all, just starting out with COVID-19, I mean, I think all of us, all of you have really been impacted by that, right? It was, I think Jennifer and I were just talking a few minutes ago about 2020 being just, what's next? And so lots of impacts. And for us right away, one of the biggest things that we had to deal with was obviously the staff health and safety. So all of our first responders, we have 93 people in the police department, 75 of those are sworn officers. So we had to think about their health and safety, and then the community safety and continuing the service that we could give to the community. So those were kind of the priorities right off the top, because just like all of you, we're just trying to figure out what is going to happen with COVID-19. So we work really closely with the fire department. So we created a COVID-19 operations manual, which has been really helpful. I called the old chief and said, you forgot to leave me the pandemic card. I don't have anything, I don't know about this COVID-19. So we had to kind of recreate all of this. And so we worked really closely with the fire department on that. And then we had to quickly figure out how can we keep our officers safe, those first responders who we couldn't get to work remotely. We had to continue our services in the community. So we had to get them fitted with personal protective gear, with gas masks. We had to get N95 masks, and we had to look at our whole facility and figure out how are we going to keep that clean? How are we going to separate out people? So you'll see here in some of these photos, we had to reconfigure the lunchroom space and remove chairs and do those same things for our briefing rooms and our roll call rooms. Because we still had staff that has to come to work every day and has to respond in the community. So we were doing this on the fly, much like all of you and your businesses, and just trying to keep people safe. So one of the first things we had to do is figure out how are we going to keep them safe when they're responding out into the community, still going on calls for service, still going into people's homes, which obviously this is really scary. I mean, there's a lot of unknowns. So right away, we thought, okay, we need to have a go bag. So you can see a photo there. We've got latex gloves and hand sanitizers and goggles and masks. And, those were the basic things that officers needed. And they're really used to wearing gloves and things like that when they're going on medicals or they're working in crime scenes, but just in their everyday contact with individuals, that's out of the norm. So one of the things we had done right away is, they've got to have goggle protection. So as we work with the fire department and the medical staff, it was like, they really have to have this. And so you'll see in that first picture in the middle there with the two officers wearing the safety goggles and their masks, they were responding out and dealing with folks. And if they would get in a foot pursuit, or they were trying to arrest someone, or they were, trying to do something that kind of got their heart rate going up, those goggles were really fogging up quick. So we had to change our protocol on that. And then you'll see the detective there on the other side of the screen has more of that ski goggle on. And so we had to move to that and do that quickly because, again, we have 911 response calls. We're responding to all sorts of things in the community. So we had to really make sure that the officers were safe when we're basically telling them we still need you, obviously, to go out into the community. So they're still wearing this PPE as we go today. Initially, we were having them just try to put this on if they were going to have to arrest someone or go into someone's home or respond to certain medicals. But what we were finding is, just sometimes there's not enough time. Things can really change rapidly. There could be a situation where they have to run off and chase someone or whatever, and you just aren't going to have time to put that PPE on. So now they're wearing it all the time. And then in the buildings, we're always wearing our cloth masks as well. So, and then the other thing we thought about is decontamination. We had to figure out a way where officers could come in and try to and actually decontaminate if they were exposed to COVID-19 or someone spit on them or someone said, I have COVID-19, I don't want to go to jail. Believe it or not, people will say these things and you have to, believe what people are saying. And so we had to have a space that they could come and, remove all their gear. I mean, you're talking all their uniforms, their vests, all their equipment, their weapons, their shoes, be able to clean all those things that they could clean, wash all those things that they could wash, and then dispose of other things. And so we made those spaces. We still have that operational, and then also the squad cars, because you have different, we don't have a squad for everyone, so they share squads, between shifts. So we had to work with facilities and just like you guys, decontaminate all of these spaces. And so they're still doing this all the time in roll calls, in the vehicles, wherever they're going. We're using those decon sprays to keep them safe as much as possible. Another thing we had to do was think about priority calls. And we do that already when we're responding to calls for service in the community. So you'll see here, if you can see on the screen, we have priority 1, 2, and 3 calls. So priority calls are really those highest priorities that we're gonna go to, an assault in progress, a robbery in progress, domestic in progress, an active shooter, something very significant. So we had to look at all of our calls and figure out, can we still respond to all these calls? Because we have to respond to our priority 1 calls. We really have got to respond to priority 2 calls. But what in priority 3 are things we can't respond to right now, or it's not safe to respond to, or how to look at that. So we really kept our continuity of service up. We were really responding to everything. But what changed a lot was that proactive contact that we had. So sometimes traffic stops. So unless there's really something reckless going on, we weren't always making traffic stops until we knew, okay, what's the best way to approach a situation when you're going up to someone, having that close contact, you're getting people's driver's licenses and insurance. So, and then also, of course, all of our community engagement events. I mean, that's where we're really proactive with the community. And, we really just had to shut that down. And that's been really hard. I think that's one of the biggest challenges we've had throughout all of COVID. So, we had to think about calls, and then we also had to think about schedules. Just really quickly, we have overlapping schedules with all of our teams because, we're really like a family in Burnsville. We really like that overlap, and that's a reason why we've kept that schedule so everybody knows everyone. But that's not a good schedule for COVID, especially at that time. So we had changed, to more of a 12-hour team schedule to kind of, as much as we could, separate our staff for their safety, for family safety, because again, they're going out and having contact with all kinds of different people in the community. We're protecting them as best as we can, but we just don't know, right? Still with COVID, there's a lot we don't know. So we worked on schedules, and then we looked a lot at our reports, and we're still looking at all of our situational reports. We do this normally, but with COVID, we tried to track some information in 6-week periods. And that was just, we just thought, okay, let's look over the last 6 weeks. And these ones you'll see here, this has to do with medicals, crisis, and mental health, because that's a whole nother presentation, right? Mental health, how people are feeling with everything going on. But you'll see on the top, that's a snapshot of mental health calls for service, medicals, and things like that. And it's a comparison from 2019 to 2020. And these are, 6 weeks. So in the very beginning from March till, beginning of May. And again, this is a snapshot in time. So really depending on when you're pulling data, this could be really different. But, we looked at these. And so each 6 weeks we could kind of see, and each week within that, you can see how many calls were there. So for mental health calls, You can see in 2019, we had 57. In 2020, we had 59. You know, it's about a 4% increase. And so we just, have that data. And then the one below that, that's a little bit more recent, up to about a couple of weeks ago. And you can see in 2019, during this 6-week period, at the same time, we had 61 total calls for mental health type calls and 4 calls for suicides. And then mental health in 2020 went up to 70 and then down to 2 suicides. So you can see how the comparisons kind of roll there. But that last 6 weeks was a pretty significant increase in mental health calls for service. And with COVID and civil unrest and just all of that, there's a lot going on with mental health. Can you guys all still hear me okay? I just want to make sure. I had a pop up on my box that the internet was an issue. Can you still hear me, Jennifer?
Yep.
We can hear you.
Okay.
Yep.
Okay, sorry about that. Just wanted to make sure. So one of the things then we do when we look at these situational reports is say, okay, maybe we want to look a little bit deeper into mental health or all of our calls for service. And so this is just a graph that gives you guys an idea over 2019 and 2020 as we look at all of our calls for service. And normally throughout a year, we can get anywhere from about 45 to 49,000 calls for service. And so these comparisons kind of break down how many calls we had in 2019 and 2020. And so you can see there's some consistency there. There's not huge peaks up or down either way, but you can see we've had some more additional calls for service in some months than others, but pretty consistent. But we can drill down further into that, and then we can look at, okay, what are we seeing with mental health calls for service? That's something we just generally know, you feel, or you can tell, like, gosh, we're really responding to a lot of mental health calls for service. And so you can see here, as we look over the last 10 years, as we've been feeling that, you can see that's accurate. Our mental health calls have nearly doubled in the last 10 years, while all of our other calls, our general calls for service are staying the same. And again, this is a presentation for another time, but we're looking at ways to work with our community and respond to those mental health calls for service in a different way, because really the last line of people calling for help is calling 911. And so I know there's a lot of agencies or just a talk around the country that, police officers shouldn't respond to these calls. But when there's nothing else in place right now, those calls are still coming to us. So we have to find and determine a way that we can, respond to those calls and keep everyone safe and just help those individuals that are suffering, from mental health crisis. So that just gives you kind of a little snapshot about mental health calls. And then, excuse me, also with COVID, we just really focused on how can we be distanced but not totally disengaged with our communities. So just, how can we still think about connecting? And that's a big part of who we are as a city, not just as a police department. That's just who we are as a city. And so you'll see some photos here. This was, we have a lot of young families that work for the city. And one of the officers thought, all of our kids are at home too, and they're making all this beautiful artwork, and, they don't want to throw it away and they don't have any place else to put it. And so one of our officers, Taylor Jacobs, came up with the idea, I'm going to collect all these great art pieces from all of the little kids and the families, and he delivered them out to our seniors in the community. So that was just wonderful. You can see there, they loved it. And then also we did parades, we did all kinds of things to sort of help connect with the community in a distanced way, but still try to keep as much engagement as we could. So those were just some of those things we did. And then recovery roadmap, just kind of high level here. We are always looking at how are we doing as a city? And we look at this individually between departments and as a city, and we really look to the governor's orders. We look to CDC recommendations and just want to have a balanced and responsible approach to, what is the next normal? Where are we at? What's happening with COVID and what makes sense to do so we can effectively run operations throughout the city and have continuity of that government. But then also, how do we keep all of our folks safe, and how do we, manage all of the individual just challenges that everyone has with COVID? So that's a lot about what we were doing, kind of high level on that. I'm going to continue on, and then we'll go to questions at the end. But the second piece of this is something I want to talk a lot about is civil unrest and emergency preparedness. And Of course, following the death of George Floyd, we had just widespread rioting throughout Minneapolis, St. Paul. Cities across the country are still experiencing this. And, you know, there's just a lot of emotion around that, a lot of calls to abolish the police, defund the police. And I'll say that, you know, there was a lot of rhetoric around Minneapolis, of course, and but I feel like Burnsville really supported us, you know, as a police department. We didn't have that rhetoric of defunding or anything like that, which is, you know, wonderful. I think it's very hard. It's a little bit harder for officers who are working on the street and seeing the things that are happening to not be worried. So, but again, a little bit more about, you know, what we did. When all that was going on in Minneapolis and St. Paul, you know, we have to continue to think about how that might spill over into Dakota County, into our cities. And so we activated a Dakota County Emergency Operations Center between all of the cities in the county. And we had all kinds of operations going so that we could maintain the safety of our own communities. And so we had, and again, these terms are, I just kind of lay these out here high level. We had mobile field force, we had quick response teams and SWAT teams. And all that really means is we had lots of resources that we were sharing so that we could make sure that our communities were safe. And so we continue to do that. We continue to do that planning in the event we're going to have more things happen. I think it's just a matter of when we might experience that. And so, or that Minneapolis and St. Paul will experience it. And then how is that going to impact our communities? Because it's very scary for everyone in the community. So one of the things as we called up the EOC is really our mission during all of that violence that was happening is to make sure we provide public safety, make sure we're protecting life, because that's always number one. We also want to make sure that people know we're protecting property. We want to maintain order. We want to maintain public peace. We want to do that while we can uphold constitutional rights folks have with freedoms of speech and the freedom to be peaceful in assembly. But, you know, that's the key word. We really had to, we want to support those peaceful protests and people having their voices heard. But when it gets into the violence, you know, we have to just draw a hard line and say, you know, we're not going to tolerate that. And so when all of these things were going on in Minneapolis, we were helping each other in the county. And then we also had teams that were helping in Oakdale or other counties, because again, as part of Dakota County Sheriff's Office has partnerships, you know, and so when there was protesting going out at the ex-Minneapolis police officers' residence in Oakdale, you know, there were small teams that were helping those folks, because you need that help, because people are quickly overwhelmed. Police departments can be overwhelmed when you're having hundreds of people show up in your city for whatever it might be, and you don't always know when it's going to happen. It just can happen very quickly. So just, you know, those were a lot of the things that we were working on and thinking about. And again, we just have that mutual aid partnership with the county. So if you ever wonder, like, what are we doing? We have mutual aid partnerships. We have joint powers agreements, and we've been doing this for years with our cities around us. So again, we definitely want to support people in their freedoms of speech and that, but we can't have the violence. And that was the biggest concern. Apple Valley had some violence happening in their city with the courthouse and some offenders that tried to burn the courthouse down. West St. Paul had several drive-by shootings. And so things were spilling out into the community. We knew that. So we really were well prepared, you know, as much as you can. You prepare for worst case scenarios and you just work through it. So just want to share that with you. And then, you know, from my perspective as a chief, and Melanie, I have these conversations, you know, my job, what I think about as the chief is my number one priority is Burnsville. So when I think about how, you know, what are we doing? I want to make sure that we can defend and protect the Burnsville community and the Burnsville businesses and protect life. So we're trying to prevent, you know, violent disturbances. We're trying to prevent against assaultive actions and defend against that. Again, protecting life, making sure there isn't property damage. If, you know, we work with the fire department, you know, we don't want to have people lighting fires, of course, or looting any businesses or government buildings or trying to take over those critical infrastructures. So there's a lot to think about in that, but I just want you guys to know I am always thinking about Burnsville first. Then I'm thinking about, okay, how can we help each other with our mutual aid partners that are most natural to us? So Egan, Lakeville, Apple Valley, and then how do we help the rest of the county if we need to? And how do we go outside the county, if we can provide support to others? And then also working with our agencies outside the county so that they can help us. So there's lots of really important partnerships that happen and are continuing to happen as we continue to prepare for the future and see where things go. So again, that's a lot. We're doing a lot. Just want to reassure you that we're working through those things. Another thing, security planning. So we really have to think about how do we prevent the destruction or takeover of any of our critical infrastructures in the city. So I've been working on my teams with this. Again, lessons learned as we work with St. Paul or Minneapolis and hear, what went right, what didn't go right. And it's not to point fingers, it's to learn and to figure out how we're going to do this the best way that we can. And because we want to make sure we have efficient operations of local government, right? We want to make sure that we can maintain that. Our buildings have sensitive data in there. There's digital, there's hard copy, there's all kinds of firearms, police vehicles, case evidence. When you're just looking at police and city hall, not to mention fire stations, the maintenance facilities, the water tower, businesses in the community. So we're really trying to plan as much as we can for, again, what is a worst case scenario and how do we manage that the best way that we can? Because during the incident is no time to have some plans or to try to figure out what you're going to do. So that was a lot. I'm gonna just check, I see a chat maybe came up here. Oh, did any of our officers get COVID? We had 2 positive COVID cases, yes. And then we follow the CDC guidelines. The city has done a great job of putting together sort of those flow charts as to, okay, what do I do if I have COVID? What do I do if I'm exposed to COVID? When do you have to quarantine? And so we were able to quarantine folks and still continue our operations. So yeah, great question. When we talk about, so of course, then with all of this civil unrest and everything we had, of course, certainly understand people's concerns following the death of George Floyd. And I think we can all agree that that should never have happened. And that just from a humanity perspective, that's just, it just brings up a lot of emotion. And so we had lots of community members reaching out for answers on, what are you doing as a police department? What reforms are you going to do? Lots of questions. I know I've got a lot of questions about 8 Can't Wait, and I'll talk about that a little bit more about what policies do you have. And just checking the chat here. Okay, another question, just I'll back up for a second. On peaceful assemblies, when do those become unpeaceful? So we have a lot of conversations about that. And I think when there is aggression towards, if you're throwing a Molotov cocktail, if you're starting to throw things at officers, rocks, concrete, feces, urine, if you're inciting violence in people where you're trying to breach a gate, if you're, breaking glass, if you're trying to loot, so there's that line between being loud and being, saying what's on your mind and totally get and understand that. But then when you're impacting the safety of officers, the community, of businesses, of property, all of those things, all of those things would indicate that violence is going to erupt. And, Melanie and I have talked a lot about this too. It's that sometimes it isn't people in the community that you're always worried about. I think people have good intentions to want to assemble and just, talk and have their voices be heard and share, information about their feelings. But what you had been seeing is sometimes there's instigators that come from outside of those groups and try to incite violence. And then sometimes you can get that groupthink and you get people doing things that they normally wouldn't do. So I'd say when their assemblies are starting to negatively impact others' safety, then they go into that other level. And so, yeah, great question on that. Excuse me. So just trying to get to my next slide here. It doesn't seem to be going. There we go. So again, as we talked about George Floyd and police accountability, there was a lot of calls about social justice reform, police accountability reform, police brutality. And so there's lots of feelings and emotions around all of that. And I think the main thing that, I wanted to get across with talking with you guys is when we talk about this, we're sort of looking at, okay, what are the inequities in the criminal justice system? So when I was getting questions from the community, it was about, what are your police practices? What are your policies on this? What is your use of force? Do you have chokeholds? Do you make officers tell officers they have to intervene? What are your arrest policies? What is your prosecution? And, to get after that, is there some disparity in what your policies are that are impacting communities of color? And so that was sort of the questions that I was getting. And I'll talk about the 8 Can't Wait campaign pretty soon, because that was a big push for a lot of the questions I know the council received, a lot of the questions I received and Melanie received. But what I'll just say about this is there isn't one solution. So, there isn't one way to say, okay, we're going to change all these things, and then this is going to get us equity. That just doesn't happen. And so when we look at all of the things we're doing in our agency, it's not just about race equity, which is very important, but it's really equity for all, for gender, for age, for sexual orientation, for all of those things. We try to look at it from a humanity perspective, because a race, it has a lot of emotion around it. And I totally understand that. And well, deservedly so, are we getting questions about what are we doing? Just trying to check and chat here again for you guys. How are you monitoring social media to stay ahead of civil threats and gatherings? It's a great question. So we have a crime analyst, and of course the crime analysts throughout the county and throughout outside the county have conferences and groups and communicate in meetings. And so they're very much engaged. They were engaged with our emergency operations center. So we had crime analysts in with us during those emergency operations. And so that's what they do. They monitor all of those things that are going on. We also have, we were also connected with the Metro Emergency Operations Center. So when they were pulling Minneapolis and St. Paul and other cities together in a large emergency operations center downtown, we were involved in that too. So, and we still have our social media crime analyst looking at social media. That's her job on a daily basis. And so we also get reports from the state of Minnesota, from the assistant commissioner, about known protests that are going on, or protests that people might be hearing about. We communicate with all of our partners again. And so, we know that this wasn't a one-time thing. Like, this is, for the foreseeable future, there's a lot of potential for more unrest or protests. And again, many of them are peaceful, and that's great. But we're just always monitoring those and being aware, okay, do we have one in our city? What does it look like? Do we need to be there? Do they want police presence or not? And so we kind of work through those things on an individual basis when we know about them. And then of course, those pop-up ones are where we have to, because we have these plans in place, we're like, okay, we can pull up teams if we need to. We can, call our neighbors. Okay, we think we're going to have 100 people at this protest and we can't manage that with our resources. So we need help from Egan and Lakeville. So we are always having those conversations. So yeah, that's a great question. Excuse me. And then, so when I go back to system equity and things like that, when we're talking about, how are our policies, equitable for all? And I just want to mention a couple things here is, if you remember in 2015, President Obama had put forth 21st century policing and 6 pillars of policing. And then us in the state of Minnesota had also worked on police involved deadly force recommendations. And that was early in February of 2020 where those recommendations had come out. And there were 28 more recommendations. There was 33 action items. President Trump has put forth safe policing for safe communities. But I think the key here word is trust. So what all of these things boil down to is having trust with your community. And how do you do that? What are the things that we need to do to make sure people know, and how can we be transparent about what we're doing? Because again, I got a lot of questions about, you need to have this policy. chief, you need to institute these things. And I welcome that. And we called every single person back that ever sent us a message about policies, because we wanted to share with them the work that we were doing. And the reality is we had these policies in place. So this was a thing that kind of got trending on social media. And so this, I just pulled up a photo here of what it was. So these are the 8 can't wait policies. And so these were the messages that I got a lot of questions about. You know, you need to ban chokeholds, and you need to ban strangleholds, and you need to have de-escalation. And so one of the things we did when I was getting these phone calls is we were calling people back. I know the council was responding to folks. And then I went before the council and explained, here's the 8 can't wait policies. This is what you're kind of getting questions about. And here's what we're doing as a police department. Here's our current practices. This is why we do the things that we do. These are things that, you know, may come up with the police accountability legislation and things we might have to change. So I think that was helpful. And then, you know, people in the community can refer to that, they can look at that, they can watch that, and then understand, you know, what it is that we're doing. On the other side of that, we did get lots and lots of, you know, support from the community. And I'm not saying it's not support when people ask these questions, because I think they're really important questions. And I welcome that, but I think it was very nice. The officers received lots of cards, lots of support. You know, we had food coming in from, you know, everywhere, and people just wanting to reach out and say, hey, we appreciate you. We want you. We don't want, you know, I think what a lot of people felt seeing, you know, Minneapolis City Council was that you're just kind of throwing all police officers out without looking at individual cases. And again, no one thinks Derek Chauvin should be an officer, and we don't want bad people in our profession, because obviously look what happens. It really gives us all a bad name. And we have exceptional, I will say, exceptional men and women that work for our police department, you know. So I think it was really nice that they got all the support. The city's been very supportive. The council's been very supportive. So that helps a lot, because we need these folks to be out in the community and responding and doing all the things that we need them to do each day. So keep going here. Police Accountability Act. So there was a lot of discussion back and forth. Senator Hall, I'm sure, could tell you even more about this, but we were getting calls from legislators and, you know, do you have these policies and how do these policies work, you know, on both sides of the aisle, and just trying to explain to folks what we were doing. And what came out of that at the end of the day was police accountability legislation. And there's something like around 23 sections of changes and information that came out of that bill. And it's a lot of provisions. A lot of it revolves around use of force. There's some around arbitration and how officers, if they're being disciplined, the process for that. Again, these areas around 8 can't wait and those kind of policies. So are you having policies that require you to de-escalate? Are you having a duty to intervene? Do you not shoot at moving vehicles? You know, all of those things. And then also there's some work around autism, and there's work around mental health and wellness for officers, because officers experience a lot of trauma, more trauma than the normal person every day. And so they've got to be well, they've got to have their minds right and their bodies and their spirits right, or we're not going to get good interaction with them and our community members. And that at the end of the day is what we want. And so there's a lot on mental health and wellness in that legislation as well. So, and what I'll say about this is I actually am doing a presentation to the council next week, specifically on police accountability and this legislation. We're on solid ground, but it's an opportunity for me again to share with the council and the community, you know, what was adopted in this legislation, what we currently have in place in Burnsville, and then how we're making adjustments, because there's a lot of mandatory policies coming out of this, and that will come from the post board. So the police officer standard testing, the licensing board, the police. So we are also working with them and waiting for them to provide some of that information as well. So a lot with that. And then just one thing I want to say to you guys, if you haven't had a chance to look at our annual report for the police department. We do one each year. I've got a link there. It kind of gives you like a day in the life of what we do as police officers, about who we are. And then we also on our webpage have a story map about who we are and things that we do. So you could certainly take a look at those things. And I just threw that photo in there. That was from one of our Blue in the School reading events. So that was obviously before COVID, but you know, that's the kind of stuff we really miss. I'm sure it's the things, you know, you guys miss, and, you know, all the impacts that all of this has on families and businesses, but really like that opportunity. That's what we're all about, is just getting in with the community and building that trust. So with that, I would turn it back over, or I don't see anything else in chat unless someone is seeing something else there, but would certainly welcome any other questions that you guys might have. And I love this photo at the end of the officers that saved the ducks out of the sewer there. Those are always fun to see. So hopefully I didn't take up too much time, but Jennifer, I'll switch it back to you and let me know if you've got any questions that you can see.
Tanya, thank you so much. This is a lot of really great information. For our businesses that are joining us today, do you have any advice on for businesses on how to stay safe, or when they should be calling for some help from the police department?
I'm sorry, Melanie, I didn't hear that first part. Are you saying?
Any advice for businesses to stay safe?
Yeah, I mean, I think the biggest thing is always call us. You know, if there's something that you're seeing outside of your business, or you're hearing about something, you guys are really our eyes and ears. And you know, I'll say that's just what hasn't changed, is we need you guys. We need to be working together. So if you're seeing something that just isn't right, or you're seeing people gathering, or you're seeing something that's just like, this isn't normal around my business, or you're hearing things, you always call us, because we'll always have an officer that can talk to you and respond. And then again, you know, we've got the crime analysts, so we can look into things. You know, we had a lot of businesses that called us during some of the riots that were going on in Minneapolis, because some were targeted for certain businesses. So like pharmacies and liquor stores or Target, you know, and we have businesses like that in Burnsville. And so we had folks calling us, and people were concerned about it. And it was really just having that communication and letting us know. And then you guys as groups too, you know, continue to communicate. You know, what are your questions going, you know, what are your concerns? Get those to us, and then we can help work those things into our plans or into our communication so that we can reassure you. I think it's, you know, I can't sit here and say 100% we are going to be able to protect every single thing that happens in the city. And that's just some of the lessons that we've learned from St. Paul, who, you know, this bubbled over to in their city for no, you know, St. Paul had nothing to do with this, right? And they did everything that they could, but they still had, you know, business owners that were harmed by that. And so I think it's just, you know, recognizing the biggest thing is your safety, right? So protecting life, protecting that safety, property can be replaced. I know we're in economic terrible times, but you've got to keep safety as your number one priority, and then just communicate with us. Call us, don't be afraid. Nothing, no question is a dumb question. No, you know, people kind of are like, I don't want to call 911 because I don't really know. That's okay. We would rather have you call us, have us look into it and have it be nothing, than to, you know, have something happen that we maybe could have gotten a jump on or helped to diffuse. Because one of the things we did when we worked with West St. Paul, and all the agencies in Dakota County worked with West St. Paul, was when people started gathering, we sent teams in right away. So we're not sitting there waiting to see what are they going to do. Are they really going to loot? Are they really going to start breaking in businesses? If there's a gathering, you know, coming to a certain area, we were sending teams in right away and trying to disperse people. And so, you know, we're not going to wait until something gets really bad. We're going to go head into those situations and figure out what's going on. So that would just be my advice, is continue to communicate with us. We got to work together, continue to communicate with each other, and just know we're doing everything that we can.
This is Mike Sweet. Can I ask a question?
Absolutely, Mike. Good morning.
You know, back in 1963, when I got my driver's permit, My father sat down with me and said, son, this is what you do when you get stopped by a policeman for a traffic violation. He didn't say if, he said when, because inevitably everybody gets stopped at one point in time. Is there any kind of, obviously that's not being done today because you see all these scenes where kids are driving off but is there any type of program with the high school where an officer goes to a high school prior to kids getting their license and just saying, here, this is what you should do. This is how you should behave.
Yes, that's a great question. Thank you, Mike. I've had that conversation with my kids as well. This is what you're going to do. This is what you do. So I think hearing it that way is definitely important. I'll say my understanding is that Driver Vehicle Services is working some of this sort of into their platform for when kids are going and doing their permit or doing their driving, what to do when you get pulled over for a traffic stop, where you're supposed to go, how you're supposed to do that. Because you're right, sometimes kids, they don't know what to do, they panic. Sometimes kids don't care and they flee, and sometimes things can go wrong. And so what I'll say about the school is, yes, we're working very closely with the school. We have 2 school resource officers. Right now we have 1 working with the school because, it's a modified platform with everything happening with COVID. And so it's a great idea. I will bring it forward to our SROs. But yes, those conversations are the types of conversations we want them having, and we encourage our school resources officers to have with the students. Because again, it's about that trust. It's about, I get nervous when there's a police car driving behind me. When I'm driving, I think, it's just like, that can be a normal reaction. So I understand, that. But yeah, great question. And I'll bring that forward to our SRO. But yes, we definitely, that would be really beneficial.
Thank you.
Thank you, Tanya. I appreciate all the information you shared, and I know that we wanted to hear from our businesses as well. So Jennifer, are you okay if we maybe, I can forego my updates and provide something written for you to share with your groups about grant programs and some tent information that has been pulled together, but I'll turn over to you to hear from our businesses. Thank you, Tanya, again. Appreciate it so much.
Thank you. I'm going to stop sharing my screen, Jennifer, if that's okay. So you can
That sounds good.
pull what you need to over there.
Yes, thank you, Melanie, and thank you, Tanya. I know, I think Tanya is going to stick around for a few minutes. Let's see. So we're just going to stop the recorded portion of our program in a second here. And what Melanie was referring to is we will be sending out information because Dakota County is opening up a second round of grants for small businesses on Monday. So we'll send out the links for that and get the information going. But for now, we will stop the recorded portion of our program and move into our business update. So thank you, Tanya, and thank you, Melanie.